Take a deep breath for me. Hello, I'm Kwan Siu. Chapter 12, Sleeping with Strangers on the Plane. 10th October 2022, Monday. 2 weeks after my discharge, my flank pain came back. It was now a standard response protocol for me to do a UCS test before I informed Dr. Devo. He would ask me to do it anyway, so it was just like doing my homework before being told. This time, there was no growth. He must be so annoyed now, but he didn't. He called me immediately. I am in Beijing at the moment. Do you want to repeat the culture test? It is unusual to get this degree of pain without an infection. Okay, I will get it done today, but I am leaving for Bangkok tomorrow. Bring your little pharmacy with you and let me know when you traced the culture. Dr. Devo had stocked me with painkillers and a few antibiotics common to treating UTI so that I could treat myself immediately when necessary and not wait until I saw him. So yes, I had a little pharmacy. When I travelled, I would bring my ear thermometer and one complete course of each antibiotic with me. It was an inconvenience, but I had adapted to adding this extra detail to my travel routine. When are you coming back? He asked. Friday. Good, me too. I will land on Friday morning. I don't have clinic that day, but if you want to drop by after you land, I will see you there. I cannot. I don't land there. I land back home. But thank you. I hope nothing traumatic will happen. Let's see what turns up in the repeat culture and I will make a trip to see you. 11th October 2022, Tuesday. I landed in Bangkok very early in the morning and I was in pain. Knowing that there was no immediate threat to my well-being, I took paracetamol and got on with my agenda. After lunch, I took a taxi to see Dr. Chop. Remember him? That was the only facility and doctor who had my records here. I was also interested to know Dr. Chop's view on my condition. When I walked into his office, he greeted me excitedly. I didn't expect him to remember me, but he did. It had been 3 years since I last saw him. You look good, he greeted me jovially. I am, thank you. After my surgery, I sent him a copy of my pathology report and updated him on my recovery progress. He was incredibly relieved that little marble didn't turn out to be cancer, but glad that I made the right decision to have it removed because, according to him, a complex kidney cyst would always hold the risk of being malignant. He was acquainted with Dr. Devo and was pleased that I was under Dr. Devo's care. He explained that we were now fortunate partial nephrectomy was an available option before the breakthrough of this technique and the development of the technology to execute it. A full nephrectomy was the only treatment for the removal of complex growth in the kidney. In fact, this was still being practiced in locations void of these means. Over 4 years, Dr. Chop taught me a lot. He equipped me with knowledge beyond the required comprehension of a patient, and I was thankful. Regardless of how many prominent doctors we surrounded ourselves with, I felt that my well-being would always be my responsibility, and it would always be my own choice to accept or reject treatment and medication. So, the more we understand, the more we can make decisions based on good judgment and not based on questionable speculation. Given what I had been through after my surgery, I told Dr. Chop to replace his tiny notepad with a bigger piece of paper. Then I started my long account, and he started his writing marathon. When I was done, I showed him the x-ray of my roller coaster track ureter, and he was shocked. Have you seen this condition before? No, not in an adult. Can I have the picture? My ureter received more paparazzi attention than I did wherever I went. I have seen 2 cases close to this, not exactly similar, but in newborns. We treat this with invasive intervention. We don't let this progress to adulthood. Have you checked your kidney function? Yes, I did a MAC 3. I informed him and immediately retrieved the report from my phone to get to the functioning percentage of each kidney. Your kidney function is not affected. I am surprised. He was very engrossed with the numbers and images on the report. You are very fortunate. Although I have not seen anyone at your age with this condition, decades of frequent inflammation cannot be good for the kidney. I knew because I had this conversation with Dr. Devo before. You have altered the environment of your urinary tract. There are no predictable conditions for us to prepare for because this is an unknown occurrence. Dr. Chop shared his views. We discussed various possible methods of treatment. Some were non-invasive, most were invasive, bordering on another surgery with the robot. Yet, like Dr. Dewell, Dr. Chop could not firmly suggest anything without knowing the root cause of the problem. I agree with Dewell on using the long-term low-dose antibiotic treatment until your condition settled. He condescended. It was the least invasive method of treatment and had the least risk of causing a disruption or inconvenience to me. Being surgeons, with hands just itching to slice into the flesh with a scalpel, both Dr. Dewell and Dr. Chop had been very conservative this time. While they were pushing very hard for surgery back when little Marble was progressing from Bosniak 3 to Bosniak 4, they treated this situation very delicately. They couldn't subject me to yet another major surgery, a procedure called pyeloplasty, a surgical procedure to remove obstruction in the ureteropelvic junction, without knowing if doing so would solve this problem entirely. Their code of ethics remained unyielding. They were so similar in practice, like Tweedledum and Tweedledee. I didn't come here with the expectation that Dr. Chop would have all the answers. I was quite sure my condition was unique. Nevertheless, having him confirm it in unworldly honesty gave rise to an unexpected feeling of disappointment. Maybe I was subconsciously wanting a different perspective, but I could not deny that it was what it was. The frustration of not knowing was disconcerting, yet I didn't want to go through another significant surgical procedure if it was unnecessary. I tried hard not to let this conflict manifest in other aspects of my life. After making sure with the ultrasound that the pain I was having was not caused by an obstruction in my urinary system, Dr. Chop was more relieved, and so was I. I could go about my trip's objectives with the help of paracetamol when necessary and resolutely make plans for further investigation when I get back. 14th October 2022, Friday. My repeat UCS test showed no evidence of bacterial growth. Dr. Dewell had texted this morning to check on me and informed me that he just landed if I needed to see him urgently. Apart from this pain I was experiencing, I was well. WhatsApp. Dr. Dewell said, we need a CT scan. I said, when? Dr. Dewell said, not urgent, but better do it before another episode. I said, I will board my flight soon. I will let you know how things progress when I get back. Our game of cat and mouse had gone cross-border. At this point, scans were done mainly to rule out certain conditions more than the need to find anything. It was not my favorite mode of imaging, but there was no other way. It was time to learn more about CT scans for myself because I didn't like to be confused by advice given by people with opinions from opposite extremes. Rightfully, I should listen to Dr. Dewell since he was the doctor. However, he struck me as a little overly scanner happy, and I was not comfortable with that. The key to good decision making is not knowledge, it is understanding. We are swimming in the former, we are desperately lacking in the latter. Quoted Malcolm Gladwell. 17th October 2022, Monday. 3 days later, I was packing for my next trip. As this trip was longer, further and more demanding, I checked with Dr. Hart if I should pack anything specific. Never thought he was more extreme than Dr. Dewell. WhatsApp. Dr. Hart said, bring your 12-lead ECG tracing, Holter report, echo report and blood tests taken recently during your admission in case you have a bad palpitation and need to go to the hospital. Never know when palpitations can happen. I said, okay, thank you. I didn't know what else to say. Between him and Dr. Dewell, I believed my entire cabin luggage would be filled to the brim with items from their lists. WhatsApp. I said, never thought Hart is more extreme than you. Dr. Dewell said, good. I said, I was hoping to travel light, but now the both of you made it impossible. Dr. Dewell said, use another luggage and ask Hart to sponsor. 20th October 2022, Wednesday. After a long transit and a long flight, I landed in Tokyo in the wee hours of the morning. Since Japan only opened its borders recently, the airport was quiet. I was greeted by very delightful weather and soon my tummy rumbled. The trip into the city lasted approximately an hour. My flight was pleasant and I had not been bothered by flying pain throughout. Although we had yet to determine the cause of it, I had been careful not to overexert myself and remember to hydrate myself gradually and sufficiently. 24th October 2022, Monday. I was happy to note that, although there were some incidents of flying pain during my trip, they were easily eased with paracetamol. There were no episodes of palpitation, which I was relieved of. I couldn't begin to imagine the horror of the language barrier at the hospital. Apart from another foot injury, my trip was uneventful. It was great to finally be on the way home. I should probably start planning for the CT scan Dr. Devo spoke about, but I didn't. Why? Because I was less anxious and more careless when I was not bothered by fever or pain. 1st November 2022, Tuesday. Dr. Devo texted to inquire about my well-being. Apparently, I had been too quiet recently. I was happy to hear from him. It was a privileged feeling to be in someone's thoughts, especially in the ever-so-busy Dr. Devo's. A feeling of dread started to fill my entire being. I had been putting off the CT scan for too long. Many dreaded the scan due to the speculation of exaggerated risks of radiation exposure, but for me, it was always just one fear: what they would find. Regardless of how I felt, I knew I couldn't put this off any longer. I told him I would call Kiyomi for an appointment next week, and at the same time see Dr. Hart to hand in my homework. If you confront your problems rather than avoid them, you will be in a better position to deal with them, quoted Dalai Lama. Thank you very much for listening. If you would like to keep following the story, click here to listen to the next chapter. And if you're new, you can start from the beginning by listening to the full playlist here. Don't forget to subscribe so you'll know when the next chapter is released. Until then, take care, take a deep breath, and I'll see you in the next one.